Hello and welcome back to the High Performance Nursing Podcast. Today we are talking about how to answer the question, tell us about your strengths and weaknesses as a nurse. So I'm going to focus and zone in on this question, albeit a question that is not often actually asked as much as it used to be. But when it is asked, it is a question that stings and it can be a deciding factor as to whether or not the panel move you forward. So I wanted to give you a little behind the scenes tea of what that looks like and how I teach people to respond to this question so that you don't get caught out. Now, of course, I always advocate that everybody that's going to an interview must prepare ahead of time. So if you have not already snagged our interview guide and interview notes template, which I will be talking about in this episode, then you must go to the Nurse Growth Hub. It is our free hub with all of our resources, liamcaswell.com/NGH. You'll get everything interview on there and everything that we add moving forward. Okay, so we need to understand what the panel are actually looking for when they ask this question. Because no question is just being asked for the sake of being asked. There's an intention behind it from the panel's perspective. So when they ask you about your strengths and weaknesses, many of us think, or maybe confuse this question, thinking that they are trying to see what we're really good at and see what we're really bad at. But in my experience, it's actually a self-awareness question. The panel wants to see that you are self-aware and that you are willing to put in the work to fill any gaps in skill and knowledge that you have that are weaknesses, and to celebrate your strengths as well, and that you acknowledge something that you're really, really, really great at. The problem with this question is that many people approach it in the wrong way and they give really generic, vague answers like, my strength is that I'm, really organized and my time management is great. That's what everybody else says too. And my weakness is that I'm just such a perfectionist. I spend so much time trying to get everything perfect that sometimes it impacts that time management that I said I was really good at. Could you see why as a panel we're like sitting there a little confused? That's why it's important to practice ahead of time for this question. So, how do we do that? What does it look like? When we're approaching this question and we're preparing ahead of time, you're going to use your notes template that you're going to download from the Nurse Growth Hub. You're going to use our interview guide there to prepare for all of the other question themes that might come up for your role specifically. And then when you get to this question, you're going to think about it like this. Step number one, when you approach this question, is you are going to be thinking about your weaknesses first and finishing with your strengths. There's a little tip here. Weakness first, finish with your strengths. We never, ever, ever want to leave them on a weakness. Imagine that. You finish the answer, you tell them about something you're not that great at, and it's pertinent to the role. Like red flag, the panel are going to be like, okay, score down on that one. So we always want to start with our weakness and move through to our strength and finish on a high. The weakness that you choose and select must not be really essential for the role. And if it is essential for the role, you have to show them that it used to be a weakness in the past and you've resolved it and you've been working towards fixing this or solving this weakness. So that's what I teach a lot of people to do. I teach them to think about a weakness that is not so pertinent to the role itself, but it's a weakness that you can focus on, that maybe when you started your nursing career, let's say you're a transition to practice RN, you've done your first year, and one weakness could be, when I first started my grad, I was really slow with medication administration. But over the last 6 to 12 months, I've really focused in on developing my medication administration knowledge, my understanding and knowledge of the 5 million rights. I'm joking, but you get me. I've been following policy and procedure. I've been taking advice from my peers and using the the NIMS book and the resources to make sure that my medication administration timeliness improves, whilst also making sure that I adhere to medication safety standard 4 within the National Safety and Quality in Healthcare Standards. So today I feel really much more confident in my medication administration skills. However, I am still working towards building competence in CVAD, medication administration, and PEG tube. That's just made it up. But you can see there that I highlighted an honest weakness. Like, this was a real weakness for me. And I have been working on it. I've gathered the literature, I've looked at the evidence, I've listened to my peers, I've sought out coaching and support. And now I feel much more confident. So we kind of turn a weakness into like a mini strength. Another example of a weakness could be for a, let's say you're a nurse educator and you're going for a nurse educator position. You could tackle this question and say, well, one weakness that I have, or I had when I first took on my senior nursing registration. No, Julius, let's start that again. So one example for a registered nurse going for a clinical nurse educator could be something along the lines of their weakness being around public speaking. And you could talk about it. Yes, it's pertinent to the role, but you could talk about how when you first became a senior nurse or when you started educating people informally and formally, that public speaking was something that really was challenging for you. And despite that discomfort and the anxiety and the fear and the worry, that you were able to work through that and to develop your skills in public speaking and verbal and nonverbal communication and being able to sell and market something to, because that's what you're doing as an educator, to people and build their skill set, which in turn helped you build the skill set of the team, which improves patient safety. And you can see the layers there. So that could be an example of a weakness that you have. And you could just flip it and say, and now I feel much more confident, but I'm still working towards developing confidence in this area. And that's why I'm really excited to apply for this position of clinical nurse educator. And then we move on to our strength. If you are a registered nurse going into a NUM position, your weakness could be something around the lines of, over the last year or so, I have started to engage in some more quality improvement projects. And I've been supporting the NUM and the educator in taking on some data collection roles and education roles in relation to the national standards and our accreditation. And what I realized is that I have a big skill gap there. I don't actually understand, or I didn't understand the Plan, Do, Study, Act cycle that we use here at Better Health Hospital. So over the last 6 to 12 months, I've really been focusing on how I can better understand that, how I can implement my learnings from that, and looking at quality improvement theory and change management principles to be able to implement change in a way that's sustainable within the ward. And as a result of that, I've been able to develop my skill set in quality improvement. So you've acknowledged that your quality improvement wasn't great, your knowledge wasn't great, you've done something about it, and now you're like, I'm at a point where I have a really solid foundation. And the reason I want this job is because I want to develop this further. Can you see how that's so much better than my weakness is that I just over deliver. I just give too much to my patients. I don't give back to myself. I mean, you can say stuff like that, but we have to use that kind of framework where, in the past, this is what I have been working towards. This is what I've done. Like, this is my weakness. This is what I've been working towards. And now this is where I'm at. This is my new baseline as I move forward into this role. So I hope you can see there how you can be really honest about a weakness, even if it is even if it is directly related to the role, but you can still show them, look at what I've been doing to achieve this competence, because that's what we're all doing. We're all just learning and growing, right? So that's our weaknesses. And then when it comes to our strengths, many people struggle with this. More people struggle with strengths naturally than they do with weaknesses. When I ask people, what are your weaknesses? They can tell me 3 million things. You don't want to tell them all your juicy, juicy weaknesses at the interview. Just keep it to 1 to 2 maximum. Always have 2 prepared. Only ever offer 1 unless they ask for more. We don't want to tell them all your weaknesses because we all have them, right? But when we move through to our strengths, this is where people struggle. And it's again because we're not used to selling and communicating ourselves. So we have to get better at that. We have to start acknowledging our achievements, looking back and seeing what we've actually achieved and what people come to us for, why they reach out to us versus other people on the ward. You might think it's super frustrating that everybody comes to you for a certain thing, but that might be your strength. That might be your thing that people see that you do so well better than other people. So instead of bitching about that and not liking that aspect of your role potentially, you can leverage that in the interview as being your strength, right? Because I know you're busy. When I say bitching, like because you're busy and like people are like, can you do this cannula? Because you're the best at cannulation. So let's talk about it in a interview setting. So a strength. If you're a new graduate nurse, what might be a strength? One of your strengths might be your ability to research the literature and to be able to understand it on a deep level and be able to translate it into your practice. How much better is that than I'm really good at time management? Give us the proof. So we always want to give them little proof points, right? So we would give them a little example. So here's what it could sound like. One of my strengths is, or what I've been recognized for as a graduate nurse, as a third year final nurse, is my ability to take really complex pathophysiology, specifically in cardiology. Let's say you're going for a cardiac grad, specifically in cardiology, and I've been able to understand that knowledge and that pathophysiology and apply it in my practice. For example, recently I was looking after a patient who had who had a ST elevation MI, and I was able to step my mentor through the pathophysiology step by step of what happened to that patient, and to be able to create a care plan in reflection after we actually dealt with the event. And I got really positive feedback from my mentor about my depth and knowledge and understanding in cardiac physiology. And that's why I'm really excited to apply for this job as a graduate nurse in cardiology. Can you see? I mean, here's the thing. I'm riffing off the top of my head because I don't like reading shit. You might have noticed. But here's the thing, it doesn't have to be clean and tidy. It can be messy. You can stumble. You can say, You can have a break in the middle. You can have a frog in your throat and swallow. It doesn't matter. Just deliver the information. It doesn't matter if it's messy. Allow it to be messy. So that's a really good example there for a grad nurse. For a registered nurse, moving into a more senior role, it could be, one of the things that I've really been commended for is my ability to create a real team culture and team connectedness. For example, when I'm on shift as a team leader, we always have the admissions coming in within 30 minutes or whatever data you can have to prove that up. Or, whilst I've been working as a team leader, I get constant feedback from the not only the nursing team but the multidisciplinary team and the patients and the relatives that the shift was really smoothly run and that there was really positive outcomes for everybody. You can work out what that would look like, but you can see there how it doesn't have to be, something super related to the role per se. I mean, ideally it would be, but it doesn't have to be. And you can just leverage whatever it is that people come to you for, or whatever feedback you get from other people. Or if you think you are a badass, kick ass leader and you've got it in the bag, tell them that. One of my strengths is the fact that I embody transformational leadership as a team leader on the floor. And for example, I achieved this by engaging the team, communicating really clearly whilst on shift, being a support point of contact, getting my hands dirty on the floor, and working with the team and solving all of the issues as they come up, delegating to the team, helping empower people to make decisions using their skills and knowledge so that we build workforce capacity. And that's why I'm really excited to apply for this clinical nurse position, because my strength is in leadership and it's what people see me. That's why people come to me. That's why the ward runs so smoothly when I'm running it. Now that sounds egotistical and overly confident, but if you've got proof to back it up, it's not egotistical and overly confident. It's a fact. Okay. Now, let's think about a nurse educator or a manager. A nurse educator, a strength could be your ability, like the grad, to take complex information and teach it to people using adult learning principles. Always find opportunities to throw in buzzwords and to connect to their position description and to connect to their vision and their values. Always, always, always be opportune in interviews. So instead of just saying I'm really good at, creating slide decks, like give them more depth. I'm really awesome at getting creative with ways to teach nurses. For example, in my current role as a senior nurse or as a nurse on the floor, I teach informally and formally cardiac skills and knowledge. And I'm a competency sign off mentor for the CVADs. And recently I recognized that people were really struggling to understand where the CVAD is actually placed in their neck or in their groin. So I leverage my skills, knowledge, and experience, and I use that my strengths in my understanding of this skill in cardiac nursing to be able to teach them in innovative creative ways. So I did this by using adult learning principles like blah blah blah, and as a result I was able to help improve the staff's knowledge and understanding of cardiac rehab and CVAD management so that they can safely care for our patients, which positively improves patient safety and outcomes. Notice there, like, no one talks like this, but this is what's required in the interview, especially if you're growing and building your nursing career. So it's about getting familiar and comfortable with selling and communicating why they should pick you and dropping all of the buzzwords in there as much as you can. So there's a couple of examples of strengths and weaknesses. So you can now see how it flows beautifully, right? So let's hear it in a full example, what it might look like. So for example, for a graduate nurse, Tell us about your strengths and weaknesses. You could say, thank you so much for the question. Have a little think about it, and then we dive in. And we say something like, let me start with my weaknesses first. So one of my weaknesses when I first started my third year or my internship as a final year student nurse was my ability to manage my time safely and effectively to be able to get all of the work done that I needed to get done and prioritize accordingly. But whilst I was on internship, I identified that this was the challenge for me. And despite my 2.5 years of experience prior to this, I really, really needed to lean into better managing my time, learning how to delegate within my team, and better utilizing my knowledge and understanding of the pathophysiology and bringing it all together to be able to safely care for our patients. So I did this by working closely with my mentor and developing and using time planners. And I used that time planner flexibly and adaptably so that I could tailor the care needs and my care delivery to the patient's holistic healthcare needs whilst they were under my care. And in doing that, in delegating to others and being really clear with my communication and my intention, at the end of that internship, I was able to get really positive feedback about how much I'd improved my time management skills. So, whilst time management is something that I'm always going to be learning, it's definitely something that I highlight as a weakness that I'm focusing on as I move into my graduate year. And now for my strength. So, I would say that my strength as a graduate nurse is my ability to build really quick, effective rapport. Having worked in customer service before becoming a nurse and working in places like Burger King and Coles, I've developed an amazing ability to be able to connect with people really quickly and to deliver high quality customer service. So naturally, my customer service experience translates beautifully into nursing. And over the last 3 years, I've really been able to show the mentors and my clinical facilitators, and of course, our patients and their families, my ability to connect on a really deep level to build that fast rapport, which has allowed me to deliver really specialized holistic nursing healthcare to our patients to meet their needs in a timely manner. So, as a graduate nurse, it's something I'm really excited to bring to Better Health Hospital so that I can build rapport in a respectful, timely manner using and leveraging multiple modes of communication, verbal and non-verbal communication, and my active listening skills to be able to better serve our patients and the community. Can you see how those examples pull together? We're acknowledging a weakness, we're acknowledging a strength, and then we're giving a little micro star, and then we're wrapping it off and we're tying it back to the organization as much as we possibly can. Imagine if you flipped it and you did strength and weakness and you finished on the weakness. The way that I teach it, you can do either, but we always want to start with weakness and come back to strength. So, my friends, today I've taught you how to answer the dreaded question that no one prepares for, that everybody must prepare for, which is tell us about your strengths and weaknesses. We go weakness first, we finish on our strength, we give them proof points, we give them buzzwords, and we prepare for this ahead of time for every single interview you go for. Because when it comes up, it will stump you and you will not be able to come up with an answer. I've seen it time and time again. So if you want more of these examples and you want to understand better how to do this, come and join us in the Nurse Growth Hub, liamcaswell.com/NGH. It is completely free. We have our interview guide in there and the interview notes template that you're going to write your strengths and weaknesses response on in there so that you don't have to go and create one yourself. So make sure you go and snag that whilst you can. And we'll see you in the Nurse Growth Hub. Until next time, have a beautiful week. Stay safe, stay forever curious, and I'll chat to you next Tuesday. Bye. Hey, thanks so much for listening. I'm so privileged that you spent your time with us here today. Hey, can I ask a favor? If you know someone that would benefit from this podcast episode, please share it with them. The more you share, the more we get in front of amazing nurses and we're able to help them see that nursing on their terms across their career is totally possible for them. So I'd love if you could do that. Now, I will see you in the next episode next week. Until then, let's make this year the year that you nurse on your terms. Are you ready? Let's do it.